I had a Rottweiler that I was seeing in practice, and he wasn't very old. I think he was maybe 4, 3 or 4, and was owned by a young couple, but he was really aggressive at the vets, really aggressive. I couldn't get anywhere near him. So they muzzled him and they were great with him and really good at handling. He came in for a vaccination about probably a couple of months ago now. And before they got him out of the car, so I went in with the vaccine already in my hand, ready, because I'd seen him before. And they were like, he's not quite right. They were like, he's been intermittently vomiting for like the last week. He's just a bit more lethargic than normal. He's weeing a lot. So they were like, we're a bit worried he's got a urinary tract infection. And I was thinking, oh, I really hope it's a urinary tract infection, and you think, I really hope it's not something else. So anyway, again, there was no way I was going to be able to do a clinical exam on him. So I sort of said, okay, well, let's get a urine sample first. We'll rule out a UTI and then we go from there. And my brain was going like, oh my God, if he's got like Addison's and he's getting poorly, how am I going to deal with this dog? How am I going to hospitalize him? Blah, blah, blah. Anyway, I did think about diabetes, was praying it wasn't. Anyway, tested its urine, absolutely full of glucose, full of ketones. And I was thinking, oh my God, this dog's diabetic. And I just thought, how on earth am I going to manage this? Like, it's at the point where the guy wasn't scared of him, but I could tell the woman was getting a little bit nervous. She was fine when he was happy and normal at home, but I knew that if I asked her to administer some treatment to this dog, she would have got a bit nervous. And she was early stages pregnant as well. So I was also had that in mind. Anyway, I chatted to them and I was like, look, I'm really sorry. I think he's diabetic. And I had the very big conversation of, if he is diabetic, which I'm very certain he probably is, but if he is diabetic, that means once or potentially twice daily insulin injections for the rest of his life. And that needs to be something that you know from the get-go, because if, diabetes used to be a fatal disease before we knew what we used to treat it. It used to be something that would kill people. And it's ultimate, or dogs, cats, etc. So if basically, long story short, they ended up wanting to know for certain. So I ended up sedating it, doing a fructosamine, getting a full acid-based bloods and all that sort of stuff to check it wasn't in DKA and etc. Anyway, it wasn't in DKA, luckily, but it had some ketones, but it wasn't properly acidotic. So I ended up loading it with fluids, sending off the fructosamine, blah, blah, blah. Anyway, it got to the point where I was teaching him how to do the injections while the dog was sleepy, because I wanted him to get comfortable with it. So we were just injecting subcut saline just for him to practice while the dog was sleepy. And I was like, 100% muzzle your dog when you do this. I said, make it something positive, but do not do this without a muzzle on, because I was like, the last thing I want to do is teach you how to do this and then you get bitten at home. Anyway, he turned around 2 days later after he'd started the dog on meds and it had bitten him. And then he brought the dog in. They decided to go for euthanasia in the end, which I do not think was the wrong decision. And they brought it in. The dog got the muzzle off as we were trying to sedate it and bit the vet that was trying to inject it really badly. Yeah, it was awful. So
Uh,
it's just a horrible situation from the get-go. But again, one of those things where I tried to have that really frank conversation with them from the get-go and be like, this could go horribly wrong. You need to think about the fact that you're already a little bit nervous of him. This is going to make him worse because you're jabbing him twice a day. You have a new baby on the way. Like, what are we doing? And sometimes, but again, I felt awful because I was like, I should have pushed them for euthanasia sooner. Like, so many people have got hurt in this process and the dog's been really stressed. When actually I had given them that option and I had stressed that option, but they didn't want it from the get-go. And sometimes those situations are just impossible. But again, as long as you have that discussion and you come across, you get on their level and you give them all the options and you say, this is not the wrong decision. If you do decide you don't want to go down this road, that is okay. And I will now say from my experience, this has happened before and it has gone terribly wrong. Hopefully other people feel free to use my example, say it can go really horribly wrong. But I don't know, sometimes there's never a right answer, but there's also never a wrong one. Does that make sense? So
I don't
it's
think
tricky.
you were going to win that one, because in the end, you've got a dog that's 3 to 4 years old, did you say? Let's say they're
Yeah.
4 years old. That's not old. So the straight away, the owner's not going to be ready to euthanize. They've not really
No.
seen, if the dog's reasonably still eating, 4 years old, I think you're not going to find, whatever you say, very few owners are going to euthanize at that point, I think.
Yeah.
I think you have to go through some pain. The only thing in this situation is it was far worse than, it was the worst outcome. But if it had just been like
I
something a bit
know.
more minor, it would have been better. But I
Yeah.
think to turn a client like that into euthanasia on the spot is going to,
It's
is a
hard.
hard push.